Let's talk about hydroxychloroquine. Hydroxychloroquine. This is a drug that can be used in some infectious disease and also some non-infectious inflammatory disease. Actually, this is in the group of DMARDs, disease-modifying anti-rheumatic drug. And in this video, I'll talk about the indication for hydroxychloroquine, the contraindication, and the side effect. So let's start with the drug itself. What is the mechanism of action? The real mechanism of hydroxychloroquine is still not clearly understood. So it's kind of unknown, the real mechanism. There are some theories, but the clear-cut mechanism is still unknown. Usually, this is taken by mouth, and most of the times well tolerated and safe during pregnancy. So you can use it in pregnancy. What are the indications for hydroxychloroquine? Let's take a different color. The indications of hydroxychloroquine include some infectious disease and some inflammatory disease, infection and inflammation. So among the infectious disease, the main indication is prophylaxis and treatment of malaria in areas where there is chloroquine sensitivity. In most of the areas, the chloroquine is resistant nowadays, but some areas the chloroquine may be sensitive. There, you can use chloroquine or hydroxychloroquine as a prophylaxis or as a treatment. For inflammatory disorders, the common inflammatory disorders that can be treated with hydroxychloroquine includes the SLE, systemic lupus erythematosus, RA, or rheumatoid arthritis, porphyria cutanea tarda, or PCT. Sometimes this can be used as a treatment for Sjogren's syndrome, and even can be used for treatment of post-Lyme arthritis. Post-Lyme arthritis. So those are the indications. What are the contraindications of hydroxychloroquine? The contraindications include a serious hypersensitivity to chloroquine. If there is a history of hypersensitivity, then we have to avoid using hydroxychloroquine. The other relative contraindications include any cardiac conditions, such as a prolongation of the QT interval, a history of diabetes, and a history of psoriasis. In those conditions, hydroxychloroquine can still be used, but with extra precaution, because this can prolong the QT interval, this can cause hypoglycemia and aggravate the psoriatic lesion. What are the side effects? So side effects are commonly the GI side effects. So in the GI system, it will cause abdominal pain, nausea, and even diarrhea. There can be cerebral side effects. It can cause headache, it can cause mania and depression. Cardiac side effects, as I mentioned before, it can prolong the QT interval. Endocrine side effect, it can cause hypoglycemia. And if we do the CBC, we'll find that hydroxychloroquine usually causes a decrease in the lymphocyte count and may cause increase in the eosinophil count. In the skin, it may lead to Stevens-Johnson syndrome. And most importantly, this is the most serious side effect of hydroxychloroquine, that is ocular toxicity. If you want to remember one thing, you have to remember this one, ocular toxicity. Hydroxychloroquine causes a retinopathy. And if there is an evidence of retinopathy, you have to stop the drug right away. So actually what we do before starting hydroxychloroquine, we must have an eye check for the patient. And after starting the drug, the patient should be regularly reviewed in an eye clinic to look for any ocular toxicity. That's all about hydroxychloroquine.